The quiet of your home, the solitude of a morning walk, or the simple peace of a relaxing evening. These are moments we cherish as we grow older. Yet it is in these very moments of solitude that a health crisis, like a heart attack, can feel most terrifying. The sudden onset of chest pain, the unsettling shortness of breath, and the creeping dread of being alone can be overwhelming. However, within that fear lies a powerful truth. Your knowledge and your actions are your greatest allies. In this video, we will provide a practical step-by-step guide designed specifically for seniors who may find themselves facing the ultimate test of strength and will entirely on their own. The steps you are about to learn are simple, clear, and free of complex medical terminology, making them easy to remember and follow, even under tremendous stress. We will walk you through exactly what to do, from the first suspicious twinge to the moment help arrives at your door. Knowing this information by heart could mean the difference between life and death, transforming a moment of panic into a series of calm, deliberate, and life-preserving actions. Before we continue, if you're enjoying this content, please like, comment, and share it with your friends or health groups on social media. Doing so helps spread valuable information and supports the growth of our channel. This video is for informational purposes only and should not be taken as medical advice. Always consult a healthcare professional or registered dietitian for personalized guidance. Now let's begin. We have all seen the dramatic movie scenes where a person clutches their chest and collapses. While that can happen, the reality of a heart attack, especially for those over 60, is often much less obvious. Your body may be sending you quieter, more subtle signals that are easy to dismiss. Learning this new language of your body is the very first step in your survival. Many seniors make the fatal mistake of ignoring these signs because they don't match the dramatic version we see on television. The most common symptom is, of course, a discomfort in the chest, but this doesn't always feel like sharp pain. It might be a pressure, a squeezing, a feeling of fullness, or simply a strange ache that won't go away. It might come and go, which makes it even easier to explain away as indigestion or muscle strain. The key is to pay attention to any new unexplained sensation in your chest that feels out of the ordinary. For women in particular, the signs can be even less typical. It is crucial to be aware that a heart attack can occur without any severe chest pain at all. You might feel an overwhelming sense of fatigue for days on end, a tiredness so deep that you can't attribute it to any activity. You might feel short of breath, as if you've just climbed a flight of stairs, even when you've been sitting still. Pain can also travel, and your heart can signal its distress in other parts of your body. Unexplained pain in the jaw, neck, or back can be a primary sign of a heart attack. This is especially true for women, who may experience this without the classic chest pressure. Don't assume a jaw ache is just a dental problem, especially if it's accompanied by other feelings of being unwell. Other warning signs are even easier to misinterpret. You might suddenly break out in a cold, clammy sweat for no reason, feeling both dizzy and nauseous. This can easily be mistaken for the flu or a sudden virus. Severe indigestion, stomach pain, or a feeling of intense nausea that seems to come out of nowhere can also be your body's cry for help. Many people have taken antacids during a heart attack, hoping for relief that never comes. The important question to ask yourself is this feeling new? Is it severe? Does it feel different from anything I've experienced before? If the answer is yes, you must entertain the possibility that it is your heart. Trust your instincts. You know your body better than anyone. If something feels profoundly wrong, it very well might be. Once you have recognized that something is wrong, you face your biggest mental and emotional hurdle. This step has nothing to do with physical action and everything to do with your state of mind. Your first and most critical action is to make a conscious decision to take your symptoms seriously. This sounds simple, but it is where many people fail. The human mind, especially one that is independent and strong, is excellent at downplaying danger. It will offer you a dozen logical-sounding excuses. It's probably just indigestion from dinner, you might think. I don't want to bother anyone or make a fuss, is another common thought. I'll just lie down for a bit and see if it passes. In a cardiac emergency, these thoughts are more dangerous than the heart attack itself. They create a fatal delay. You must actively fight this urge to downplay. The moment those unusual signs appear, the chest pressure, the jaw pain, the cold sweat, you need to have an internal conversation with yourself. Acknowledge the fear, but do not let it paralyze you. Say to yourself out loud if you need to, "This could be a heart attack. I am not overreacting. My life could be in danger, and I need to act now." This self-talk is a powerful tool. It cuts through the denial and moves you from a passive state of worry into an active state of survival. Making this decision is a courageous act. It means overriding a lifetime of habit where you might have been taught to be stoic and not complain. In this situation, being stoic is the riskiest thing you can do. Promise yourself that you will not wait. Time is muscle, meaning that the longer your heart is deprived of oxygen, the more permanent damage is done. Every minute you spend trying to self-diagnose or hoping the feeling will go away is a minute of precious heart tissue being lost. Deciding to act is not a sign of weakness. It is the ultimate sign of strength and self-preservation. This mental shift is the foundation for every single step that follows. Without this decision, you might not make the call. You might not unlock the door. You might not take the aspirin. The moment you have decided to take your symptoms seriously, your very first physical action must be to call for emergency help. In the United States, this means dialing 911. If you are in another country, know the local emergency number and have it readily available. This step is non-negotiable. Do not call your son or daughter first. Do not call your neighbor or a friend who lives 10 minutes away. Your first call must be to the professionals who can provide life-saving care and transport you to the hospital. This is the single most important action you will take, and its speed directly impacts your outcome. When you pick up the phone, your mission is to get a team of paramedics on their way to your location as quickly as possible. When the operator answers, you need to be as clear as possible, even if you are scared. Do not say, "I'm not feeling well." This is too vague. You must use clear, direct language. Say, "I think I am having a heart attack." These specific words trigger a different, faster protocol for the emergency services. They will immediately understand the gravity of the situation. After stating the emergency, the next most critical piece of information is your location. Clearly state your full address, including the town or city. If you are in an apartment building, give your apartment number and the access code if there is one. The operator will stay on the line with you, and it is vital that you follow their instructions. They are trained to help you through this. People often hesitate to call an ambulance because they worry about the cost or feel embarrassed if it turns out to be a false alarm. You must put these thoughts completely out of your mind. Paramedics would much rather respond to a call that turns out to be a false alarm than arrive too late to a real one. They are not judging you. They are there to help. Furthermore, emergency medical technicians can begin treatment the moment they arrive. They can administer oxygen, take an EKG, and give medications that can start to break up a clot, all before you even reach the hospital. This pre-hospital care is invaluable and something a loved one driving you cannot provide. By calling 911 first, you are essentially bringing the first part of the emergency room directly to your doorstep. Keep the phone on speaker if you can, so your hands are free, and stay on the line until the operator tells you it's okay to hang up. Your job is to be the calm, clear link that brings the help you need racing to your door. Once you have made the call to emergency services, your next priority is to ensure that the help you called for can actually get to you. This is a simple, yet profoundly important step that is often overlooked in the panic of the moment. If you are able to move without causing extreme pain or dizziness, you should slowly and carefully make your way to your front door and unlock it. If you have a screen door or a storm door, unlock that as well. If it is safe to do so, you can even leave the door slightly ajar. The goal is to remove every single barrier between you and the paramedics. In a medical emergency, seconds count, and the time it takes for a crew to force entry into a locked home can be the difference between a good outcome and a tragic one. Think about the process from the paramedics' perspective. They arrive at your address with their heavy equipment, fueled by adrenaline and ready to help. If they find a locked door, they are forced to stop. They may have to buzz other apartments, try to call you back, or look for a superintendent. In a worst-case scenario, if you are unconscious and cannot respond, they will have to break the door down. This involves using a heavy ram or other tools, a process that is loud, stressful, and can take several precious minutes. Those are minutes that your heart muscle may not have. By simply turning the lock, you are eliminating this entire delay. You are creating a clear, direct path for your rescuers. This action is about thinking ahead. Even if you are feeling okay enough to answer the door when they arrive, your condition could change in an instant. You could lose consciousness, become confused, or be unable to move. By unlocking the door immediately after your call, you are preparing for the worst-case scenario. It is an act of foresight that guarantees access. If you have a chain lock high up on the door, consider leaving it off for now. The ideal situation is for the paramedics to be able to open the door and enter without any hesitation or extra steps. After you have unlocked the door, return to your safe position on the floor near the entrance, so you are easy to find. When you feel unwell, your natural instinct is probably to lie down in your bed or on your comfortable couch. It is a deeply ingrained habit to seek the comfort and softness of a familiar place when we are in distress. However, in the event of a heart attack, this instinct can be dangerously wrong. Your bed or a plush sofa, while comfortable, presents a serious risk if you were to lose consciousness. The higher surface means a longer, harder fall to the ground. A fall from a bed can cause head injuries, broken bones, or other trauma that would complicate your medical situation and make it much more difficult for paramedics to help you. Therefore, the safest place you can be is already on the floor. The floor is the most stable and secure surface available. By carefully getting yourself down to the floor, you are eliminating the risk of a fall entirely. This is a proactive step to prevent a secondary injury. Move slowly and deliberately. If you need to, you can first sit on the edge of your bed or chair, then lower yourself down to your knees, and then carefully lie down on your side before rolling onto your back. The goal is to avoid any sudden, strenuous movements that could put extra strain on your heart. Once you are on the floor, you are in a safe, predictable position. If you were to pass out, you would remain right where you are, and the paramedics would find you in a location where they can immediately begin treatment without having to move you from a high bed. Furthermore, being on the floor makes it significantly easier for the emergency crew when they arrive. They need to be able to assess you, place electrodes on your chest for an EKG, and potentially perform CPR. Trying to do this on a soft, sinking mattress is very difficult and inefficient. A firm, solid floor provides the perfect platform for them to work. They can kneel beside you and have easy access to your entire body. It is also much safer and ergonomic for them to lift you from the floor onto a gurney than to maneuver you out of a low-sided bed. Now that you are safely on the floor, you might wonder what the best position is to be in. Simply lying flat on your back is not ideal. When you lie completely flat, your body has to work a bit harder to circulate blood, and your diaphragm has less room to move, which can make you feel more short of breath. The goal is to find a position that helps your heart as much as possible by making its job easier. The best way to do this is to assume a resting position that elevates your upper body and your knees. This is often called a half-sitting or reclining position. It is a simple but powerful way to ease the physical burden on your body while you wait for help. To get into this position, you will want to prop up your upper back and head with pillows, cushions, or even a folded-up blanket or jacket. You don't need to be sitting straight up. Just a slight elevation of about 30 to 45 degrees makes a significant difference. Then, bend your knees and place another pillow or cushion underneath them so your knees are bent and your feet are flat on the floor. This position with your knees bent is crucial. It helps to improve blood flow back to your heart and takes pressure off your abdominal area, allowing your lungs more space to expand. You will likely find that this posture makes it easier to breathe deeply and calmly. It reduces the feeling of pressure in your chest and helps to prevent you from slumping over if you become weak. This is not just about physical comfort. It is a therapeutic position. By elevating your upper body, you are reducing the amount of work your heart has to do to pump blood to your brain. Every little bit of strain you can remove from your heart during this crisis is a benefit. It allows what little oxygenated blood is getting through to be used more efficiently for your most vital organs. Focus on relaxing your muscles in this position. Unclench your jaw, drop your shoulders, and let your arms rest comfortably at your sides. Combine this physical posture with the deep breathing we will discuss later. You may have heard that aspirin can be helpful during a heart attack. This is true, but it comes with very important conditions. Aspirin works by helping to thin your blood and prevent further blood clotting, which is often the cause of a heart attack. However, this step should only be taken if you can do it safely and easily. Your priority remains staying calm and still. Do not stand up. Do not go rummaging through a distant bathroom cabinet, and do not strain yourself to find the aspirin. The only time you should consider this is if you have a bottle of aspirin readily available within arm's reach, or in a nearby drawer or table that you can access without getting up from your safe position on the floor. If you can easily reach a regular, non-coated 325 milligram aspirin, the recommended method is to chew it slowly and then swallow it. Do not just swallow it whole. Chewing the aspirin breaks it down very quickly and allows it to get into your bloodstream much faster, potentially within minutes. Swallowing it whole means it has to go through your digestive system first, which takes much longer. If you only have low-dose, 81 milligram aspirin, you would typically chew 4 of them to get a similar dose, but it is always best to follow the instructions of the 911 operator if they give you guidance. The operator may ask if you have taken aspirin and can advise you. It is absolutely vital to remember that you should not take aspirin if you are allergic to it, or if your doctor has specifically told you not to take it due to other medical conditions or medications. If you are unsure, it is safer to skip this step. The benefits of aspirin are significant, but they are not worth the risk of a severe allergic reaction. Also, do not take any other pain medications like ibuprofen or naproxen. These do not have the same blood-thinning effect and are not helpful in this situation. Taking aspirin is a supportive measure, a small thing you can do to potentially slow the progress of the heart attack. It is not a cure, and it does not replace the urgent need for professional medical care. It is simply one tool in your kit to be used wisely and safely if the circumstances are exactly right. As you wait for the paramedics, you might feel thirsty or think that having a sip of water or eating a little something for energy might help you feel better. This is a dangerous impulse that you must resist. With the sole exception of the aspirin mentioned earlier, You should put nothing else in your mouth. Do not drink water. Do not drink juice. Do not eat a snack or a piece of candy. The reason for this is critically important and relates to what might happen after you get to the hospital. If your heart attack is severe, there is a significant chance that you will need to undergo an emergency procedure or even surgery. For any procedure that requires anesthesia, having an empty stomach is a fundamental safety requirement. When you are under anesthesia, the reflexes that normally prevent you from choking are suppressed. If there is food or liquid in your stomach, it can be regurgitated and breathed into your lungs. This can cause a serious condition called aspiration pneumonia, a severe lung infection that can be life-threatening on its own. By keeping your stomach empty, you are making it safe for the doctors to perform any necessary life-saving procedures immediately upon your arrival at the hospital without having to wait hours for your stomach to empty. A delay of even an hour could be critical. You are, in effect, keeping yourself procedure ready. Furthermore, your body is under immense stress. Your digestive system requires a significant amount of energy and blood flow to function. By introducing food or drink, you are diverting precious blood and energy away from your heart and brain, your two most vital organs in this crisis, and sending it to your stomach. Your body does not need the extra task of digestion right now. It needs to focus all its remaining resources on keeping your heart and brain alive. The feeling of thirst is understandable, but it is better to simply rinse your mouth with water and spit it out if you must, rather than swallowing. This one rule is simple. From the moment you suspect a heart attack, consider your mouth closed to all food and drink. You are helping the medical team help you in the most efficient way possible. Surviving a heart attack when you are alone depends almost entirely on what you do in the first few minutes. It hinges on your knowledge and your ability to act decisively, even through the fear. The steps outlined here are your mental checklist. This knowledge is your power. Review these steps, share them with your friends and loved ones, and keep them in a place in your mind where you can access them even under stress. Being prepared is the greatest defense. You have the strength and the wisdom to save your own life.